Join us now for Health for Life, brought to you by Hamilton Healthcare System. Today we're talking with Dr. Sarbjit Masson of Hamilton Internal Medicine Clinic. Thank you for joining us today, Dr. Masson.
Glad to be here.
Dr. Masson is a board-certified internal medicine physician and one of the attending physicians at a new physician practice called Hamilton Internal Medicine Clinic. Dr. Masson, how long have you been with Hamilton?
So this will be my 5th month with Hamilton.
So you've been with Hamilton only 5 months?
Yes, so far.
Where are you from?
Originally from Toronto, Canada, but I did my training at East Tennessee State University.
That's great. What do you like to do in your spare time?
So,
if you have any spare time.
That's a good question. So I always like to now split it up into 2 different phases of my life. I say before COVID and after COVID.
Right.
Before COVID, I usually would find myself trying different foods, traveling, with any time, spare time I did have, trying to stay active, a lot of outdoor activities. But since COVID now, life has obviously changed quite a bit. Can't be doing big crowds anymore. So I stick to doing a lot more outdoor activities, hiking, biking, and also working out quite a bit these days as well to stay fit, yes.
Wow. Now, when it comes, you said you enjoy going to different restaurants, or you like trying different foods?
Different foods, yes.
Yeah, what's some of the different foods that you found that you like?
Definitely so far, my favorite has been Mediterranean food. Again, very easy on the stomach, good flavor, and very healthy for you also.
Wow, that's great. And you're from Toronto.
Yes.
Now, I have been to Toronto one time. I went to see the Atlanta Braves play the Blue Jays.
Yes.
That was the first time that ever played a World Series game outside the United States.
Oh, wow. I did not know that.
That was a lot of fun. I was there for that. And I remember the city was so clean.
That's honestly what I've heard from a lot of people that have visited the city before.
Now, why did you choose to become an internal medicine physician?
So I chose internal medicine because it coincides with my personal philosophy about wellness and health. Our health is the result of interactions between our mind, body, and the environment. When someone is ill, you cannot solely rely on one aspect and ignore the others. Mm-hmm. We have to approach health from a holistic point of view where we address not only the sickness, but the factors leading up to that sickness, including our behaviors and at times our beliefs. The specialty of internal medicine allows me to do that while also challenging me academically, as I am responsible for the upkeep of all the various organ systems with their complex interactions that function every day to allow us to go about our daily lives.
Wow, that is wonderful. Now, explain to our listeners the difference between internal medicine and family medicine.
So internal medicine is a discipline of specialists trained broadly and extensively to meet the healthcare needs of most adults. The internists, as we're called, combine the knowledge of basic medical science with the humanistic aspect of medicine. This means focus on human welfare, values, and dignity. Many people don't know that there are actually 4 types of primary care physicians. The first and foremost, like you mentioned, was the family medicine doctor. The unique benefit of a family medicine doctor is that they care for your whole family. They have the experience to see everything from babies to children to parents and grandparents. So as you go through the different phases of life, they're prepared to meet your healthcare needs. No matter who in your family is sick, you have one person to call who knows your family history and can provide highly personalized care to you and your family. A family medicine doctor can be a convenient option for busy parents who want to take care of multiple family appointments on the same day. Now, the second type is pediatricians. Pediatricians specialize in caring for children from birth through early adulthood. They're trained to treat minor illnesses and injuries, along with more complex medical conditions as well. Pediatricians are experts at understanding developmental milestones and keeping children on track towards a healthy future in adulthood. Mm-hmm. Number 3 is, which also a lot of people know about, are the OB and gynecologists. These are doctors that are experts in women's health. They provide routine women's health services and screenings and can practice with a primary care clinic or a specialty office as well. And then finally, number 4 are the internal medicine physicians, which also, as I mentioned before, are called internists, and issues that primarily affect adults like high blood pressure, type 2 diabetes. Internal medicine doctors are trained to treat both simple and complex medical conditions. They're experts at balancing your regular preventive care with your specialized care needs.
And that's what you do.
Yes, that's my role in the community. Yes.
I got you. Very important. A lot of great information. We're going to take a quick break. When we come back, we're going to talk about who should see an internal medicine physician.
If you're in need of medical care, don't delay. Your health won't wait. Hamilton Medical Center is ready to care for you. We are following CDC guidelines. Patients and guests are screened for COVID-19 symptoms. Those who are suspected to have the virus are treated in a separate area. Plus, Hamilton's high-powered UV light robots eliminate 99.9% of bacteria and viruses on surfaces. Please do not delay medical care. Your health won't wait. As always, Hamilton is here for you.
Welcome back to Health for Life. Today we're talking with Dr. Sarbjit Masson of the Hamilton Internal Medicine Clinic. Great to have you on the show. Being an internal medicine physician, who are some of the folks that should see you?
So typically, we see adults who are dealing with one or more chronic conditions. We can help them with issues and treatments related to acute respiratory infections such as the common flu, asthma, bronchitis, chest pain, diabetes care, fatigue, high blood cholesterol and triglycerides, high blood pressure, also called hypertension, thyroid problems, both under-functioning and over-functioning thyroid, menopause, migraines, arthritis, osteoporosis, pneumonia, just to name a few things.
Wow. Now, when you're talking about the thyroid, I've always heard that that's very complicated. It's a moving target. It's hard to diagnose, but once you get there and you get it right, it's fabulous.
It definitely is. People can present with all sorts of symptoms, and we can run a few tests, and once we have you on the right dose of the medication, life just goes back to functioning the way you were before.
Wow, that is wonderful, and that's the kind of work that you do.
Yes, and if we need more specialized care, we can refer our patients to those specialized doctors as well.
And there's lots of those at Hamilton.
Yes, we have all the specialties that we need to take care of, from everything from your head to toe.
Tell us about Hamilton Internal Medicine Clinic. Now, how is that different from other physician practices?
So, Hamilton Internal Medicine Clinic is now the first teaching facility in the city of Dalton, Georgia. It's a new physician practice where resident physicians will provide comprehensive medical treatment under the supervision of a board-certified internal medicine physician such as myself. Along with my colleague, who's also there as well, Dr. Daniel Grace. So we both are the attending supervising physicians at the clinic, which is part of Hamilton's new internal medicine residency program. There is also Dr. Deidre Pierce, who is the program director, also another supervising physician as well. So currently we have about 18 resident physicians who rotate through different parts of the hospital and along with the clinic as well. So whether you need medical care for a common illness or a complex or a chronic medical condition, our team will take the time to listen to you and provide the latest advances in medical treatment. Services provided at our clinic are geared towards preventative, diagnostic, and treatment of internal medicine diseases of all types. Typical visits for physical exams, diabetes management, hypertension, and other general health services are also provided by our resident physicians under the guidance of our supervising attending physicians.
Very interesting. We're going to be right back. We're going to take a quick break. We'll be talking more on Health for Life in just a moment. Please don't go away.
Is it time for a heart-to-heart? Ask your primary care physician if you should have a heart-to-heart with one of Hamilton Physician Group's board-certified cardiologists. If you have high cholesterol, high blood pressure, or diabetes, this can be especially important. Hamilton Physician Group Cardiology, located at 1436 Broderick Drive in Dalton. Call 706-226-3434 or visit hamiltonhealth.com/cardiology. That's 706-226-3434.
Be a hero. Stop a stroke. If you think someone you're with is having a stroke, ask him to smile. Does his face droop? Have him raise both arms. Does one arm drift down? Can he repeat a simple phrase without slurring? If you see even one of these symptoms, call 911 right away. Because when it's a stroke, every second counts. Hamilton Medical Center has a nationally ranked, highly trained rapid stroke team ready to care for you. Hamilton Medical Center. Health for life.
Did you know that colon cancer claims over 50,000 lives each year? The good news is that colonoscopies save lives. Convenient appointments are available at Hamilton Medical Center's new Bandy Endoscopy Center, located at the corner of Broderick and Memorial Drives. Hamilton follows CDC guidelines and screens for COVID-19 symptoms at the door. If you are age 50 or older or have a family history of colon cancer, ask your primary care provider to schedule your colonoscopy. Please don't delay important medical screenings. Your health won't wait. If you're in need of medical care, don't delay. Your health won't wait. Hamilton Medical Center is ready to care for you. We are following CDC guidelines. Patients and guests are screened for COVID-19 symptoms. Those who are suspected to have the virus are treated in a separate area. Plus, Hamilton's high-powered UV light robots eliminate 99.9% of bacteria and viruses on surfaces. Please do not delay medical care. Your health won't wait. As always, Hamilton is here for you.
Welcome back to Health for Life. You mentioned resident physicians before our break. Are they doctors?
Yes, resident physicians are also doctors. They are doctors in training. That's the best way to put it. They have graduated from medical school and have been awarded their MD degrees and now are in training to be a particular type of doctor. And in our case, an internal medicine physician.
Okay.
The internal medicine residency program, which lasts 3 years, is, like I mentioned before, the first teaching program at Hamilton Medical Center.
Okay.
Some of our residents are currently in their first year, and we also have some who are in their second year of training as well.
And it's a 3-year program.
Yes, indeed.
So you're telling me that Hamilton is a teaching hospital?
Yes, so Hamilton Healthcare System is now an academic institution as well. We had more than 2,700 applicants for our residency program, and we had to narrow this down just to 18 residents, which was an incredible feat that had to be taken care of by the program leadership.
Right.
We could not have wished for a better group of physicians to start our residency program at this point. Hamilton has been partnering with medical schools and has had almost 20 medical students rotating in the system during the past year. Medical school partnerships include Medical College of Georgia, Augusta University, and the Philadelphia College of Osteopathic Medicine. We are also in the process of starting a brand new family medicine residency program as well, that will be started in July of 2021. And this will be under the leadership of Dr. Brian Cheever of the Hamilton Physician Group Primary Care in Dalton. And he has taken the role of program director for this planned family medicine residency that is to be started in summer of 2021. Dr. Jonathan Thompson will also assist Cheever as associate program director.
Now, let me ask you this. Why should someone be seen in a residency clinic?
So that's a very good question, Bobby. With our residents, our patients are scheduled for 1-hour appointments to holistically address their health care needs and answer all their questions. The additional benefit of being a patient in our clinic is you get to be seen in an academic setting, so you get care based on the latest research in medical diagnosis and treatment. Also, as a patient in our residency clinic, you get to play an integral part in training the next generation of physicians that will be emerging from our community.
Wow. Now, these are doctors that have gone through medical school, but they have to learn in the real world. Is that what I understand?
Yes, there are doctors in training.
I understand. That's the residency. Now, there are people like you who are supervisors.
Yes, for both safety and for learning purposes, they are always under the supervision of a board-certified physician.
But these doctors, they're not necessarily board-certified physicians at this point, but they're still doctors.
They still are doctors. After about 3 years of training, they will be in a position to be board-certified.
I understand. Now, you said holistic?
Yes.
Now, explain that to me.
Holistic, to me, encompasses both the mind and the body and the environment, like I talked about earlier.
Mm-hmm.
So, to me, we need to not only address the illness in front of us, we need to address the behaviors that might be leading up to those illnesses.
And why we're getting sick with that?
Yes, exactly. And
Okay.
to address the environmental factors related to that as well. For example, diabetes being one of the more common diseases that are now prevalent in the community, we want to explain to our patients that it's not just an illness, let's say like the flu where you catch it, it's based on our behaviors over years and years that eventually leads for that disease to manifest in our bodies. So we address both the behaviors, the disease, and some patients, the steps to prevent from getting those diseases.
I understand. And when you're talking about diabetes, because so many of our listeners have diabetes, and in this part of the country, I think it has a lot to do, like you said, with our lifestyle, with the foods that we eat. A lot of people are heavier than they need to be, and they just don't get enough exercise, and that diabetes is a terrible disease, and I'm glad to know that you guys work hard to treat that.
Yes, we work hard both not only to treat, but to prevent those and to educate our patients in what they can do to reduce the burden and the suffering that can result from having diabetes in a long-term setting.
Absolutely. Exactly. That's great. Well, stay with me. We'll be back. We want to talk about COVID-19 here in just a few minutes. And we also want to talk about what kind of services that you provide at the Hamilton Internal Medicine Clinic. We'll be right back.
Do you snore? Are you always tired? You could be suffering from obstructive sleep apnea. Hamilton Regional Sleep Center provides real solutions for sleep apnea, insomnia, narcolepsy, and restless leg syndrome. Overnight sleep testing is conducted by highly trained technologists in a warm and friendly environment. Call Hamilton Regional Sleep Center 706-278-4757. That's 706-278-4757.
Be a hero. Stop a stroke. If you think someone you're with is having a stroke, ask him to smile. Does his face droop? Have him raise both arms. Does one arm drift down? Can he repeat a simple phrase without slurring? If you see even one of these symptoms, call 911 right away. Because when it's a stroke, every second counts. Hamilton Medical Center has a nationally ranked, highly trained rapid stroke team ready to care for you. Hamilton Medical Center. Health for life.
Right care, right time, right at home. Hamilton Physician Group now offers telehealth appointments through your mobile phone, tablet, or computer. Connect with your healthcare provider in the comfort of your own home. Call any Hamilton Physician Group office or visit hamiltonhealth.com/telehealth to schedule your appointment. Most health insurance plans are accepted and self-pay options are available. Hamilton Physician Group, we're here for you. If you are sick with COVID-19 or think you might have it, take steps to help protect other people from getting sick. Stay home except to get medical care. Call the doctor before visiting. Separate yourself from others who live with you. Wear a mask to protect others. Cover your coughs and sneezes with a tissue and clean your hands right away. Avoid sharing items with other people in your home. And stay aware of how you feel. If you start to have difficulty breathing or you're worried about your health, call your doctor. For more information, visit hamiltonhealth.com or cdc.gov. If you're in need of medical care, don't delay. Your health won't wait. Hamilton Medical Center is ready to care for you. We are following CDC guidelines. Patients and guests are screened for COVID-19 symptoms. Those who are suspected to have the virus are treated in a separate area. Plus, Hamilton's high-powered UV light robots eliminate 99.9% of bacteria and viruses on surfaces. Please do not delay medical care. Your health won't wait. As always, Hamilton is here for you.
Welcome back to Health for Life. Tell us more about Hamilton Internal Medicine Clinic. What kind of services do you provide at the clinic?
At our clinic, whether you need medical care for a common illness or a complex or chronic medical condition, our team of both residents and their supervising physicians will take the time to listen to you and provide the latest advances in medical diagnosis along with treatment. We provide things like annual exams, management for patients with diabetes, management for patients with high blood pressure and high cholesterol, management of depression and anxiety in patients suffering from those illnesses, arthritis management, respiratory infections, minor surgical procedures. We also have on-site lab work, which is currently in the process of being certified. Most health insurance plans are also accepted, including Medicare and Medicaid.
You know, that's wonderful that this is a teaching environment for those doctors. They're in their residency. Am I saying that right?
Yes, for the doctors in the residency program. I think what I love about my job is not only getting to treat patients and helping them to go about their daily lives in a healthy manner, but also to promote medical education, not only within the community and our patients, but also within the medical community as well. I find teaching as a passion, and to be able to teach medicine towards the next generation of physicians, I really find that to be rewarding.
I understand. Now, you were saying earlier there's 18 in this residency program?
Yes, there are 18. So because our program is a new program, we have about 12 first-year residents and about 6 second-year residents. But over time, as we go through the next few years, each year of residence will have a class of about 12 residents, meaning at its full strength, the program will host 36 residents.
Oh, that's very strong. That's very good. Right now you have 18, and we're talking about a 3-year residency. Is that correct?
Yes, sir.
So right now you have second-year residents, and then, of course, next year you'll start with your third-year program.
Yes, so next year, those second-year residents will become third-year residents, and those first-year residents will become their second-year residents.
And you'll bring a whole new class in.
Exactly, and a whole new class of first-year residents who both the second, the third-year residents, along with their attending supervising physicians, will be training the first-year residents.
I think that's wonderful. And another thing that I really like about this is that you allot an hour for each patient. Is that right?
Yes, an hour indeed, to provide holistic medical care to our patients, along with making sure our residents are able to have the time to study the medicine involved in patient care. We have these 1-hour blocks for our patients.
So in that hour, that gives us as a patient a chance to ask a lot of questions, and it gives the doctors who are in their residency the opportunity to work with one patient for 60 minutes. And then the supervisor comes in. There might be another doctor there who is also in residency. I think that's a great program.
Yes, this is a lot of overlap with different physicians involved in the care of a single patient, which to me, I feel like the more brains that are involved in the care, the better the care will be.
So how does COVID-19 differ from the flu?
So that's a good question, Bobby. The flu also is a virus, and so is COVID-19.
Mm-hmm.
But the problem with COVID-19 is this virus is a lot more contagious. So the chances of you catching it, if there is someone who has the virus near you, is significantly higher than with the flu. Also, although a significant portion of patients who catch COVID-19 recover, as compared to the flu, a lot higher percentage of people are requiring hospitalization because of this illness. And this is for respiratory failure, which just means your lungs cannot put enough oxygen into your blood, which they normally have an excellent job of doing. And as a result of this, patients need to be put on oxygen and need to be monitored for a couple of weeks in the hospital. Lastly, as compared to the flu, a much higher percentage of patients are dying directly from this virus. And even those without any chronic conditions are dying at a higher rate as well. So anyone that catches this disease is not safe. It's like playing Russian roulette.
I understand. And it is surprising to me how many more people are hospitalized with this compared to the flu.
Yes. So the percentage of people that are getting hospitalized after they've contracted this disease is a lot higher as compared to the flu.
Now, how can I prevent myself from contracting COVID-19? What's something I can do to help me not get it?
That's probably the more important question, Bobby. I know there's a lot of doom and gloom in terms of the news about this virus, but I do want to put out to our listeners that there is hope on the horizon. So first of all, we don't need any advanced medical equipment in going about preventing from catching this disease.
Okay.
It's pretty simple, actually. We have to minimize our risk of catching this disease, and we do this by avoiding big crowds. The reason is, although I expect most people in these days, if anyone does have any symptoms, probably stays home, but there are cases, known documented cases, where people feel absolutely fine and they still have this disease, and they can pass on this disease to other people even when they themselves don't feel anything. And these other people, when they do catch this disease from these people who are not feeling anything, can go about and have the disease, have it afflict their bodies and do the damage it does. So, like I said, first things first is to avoid big crowds. If you do need to go outside, do need to go about your daily lives, obviously those things cannot stop. The best way to prevent you from catching this is to wear masks. And that's basically what it does is, it actually prevents you from giving it to someone else. So if everyone around you is wearing masks, it significantly reduces the chances of anyone catching this disease. Also, washing your hands frequently. I cannot stress this enough. washing our hands is probably one of the easiest ways we can go about preventing this disease. Also, there is a vaccine in development with good preliminary results. So when that does eventually get approved, I would suggest to the listeners to do their research and to go about getting this vaccine as well.
Well, I was hearing vaccine numbers as great as 95% of that vaccine, which that is fantastic.
Those are some really promising results at this point in the vaccine development. Yes, those numbers are definitely encouraging, but at the same time, the whole process needs to complete itself before this vaccine can be released to the public.
Well, it's going to be wonderful when it is released to the public, and I can't wait for that. Like so many of our listeners, I am ready for things to get back to normal.
Me too, Bobby. I think, more than anything, although as much as I hate putting my life on pause, as much as I do not like wearing these masks, I'm doing it in an effort so this period of time where we have to do this is as short as possible. So I can go about going back to my life to normal, so I can go see my family as soon as possible.
Dr. Masson, very good information, a great show today. Before you leave, I want to give you one last opportunity. If there's anything that you want to pass along to our listeners, what would that be?
All I want to say is I'm glad to be here. I'm glad to be part of serving our community here in Dalton, Georgia, and for the community to give us a chance to take care of their healthcare needs.
Good. Very good. And that residency program, that is fabulous.
I appreciate that again. Thank you.
For more information or an appointment at Hamilton Internal Medicine Clinic, call this number, 706-226-8990, 706-226-8990, or visit hamiltonhealth.com/internal.
Did you know that colon cancer claims over 50,000 lives each year? The good news is that colonoscopies save lives. Convenient appointments are available at Hamilton Medical Center's new Bandy Endoscopy Center, located at the corner of Broderick and Memorial Drives. Hamilton follows CDC guidelines and screens for COVID-19 symptoms at the door. If you are age 50 or older or have a family history of colon cancer, ask your primary care provider to schedule your colonoscopy. Please don't delay important medical screenings. Your health won't wait.
At Hamilton Hospice, we don't just care for the patient, we provide compassionate support for the entire family. Early intervention can significantly impact a patient's comfort and quality of life, and allow family members to focus on embracing special moments with their loved one. Hamilton Hospice has provided compassionate, expert care to North Georgia for over 30 years. Call 706-278-2848 or visit hamiltonhealth.com/hospice to learn more.
If you are sick with COVID-19 or think you might have it, take steps to help protect other people from getting sick. Stay home except to get medical care. Call the doctor before visiting. Separate yourself from others who live with you. Wear a mask to protect others. Cover your coughs and sneezes with a tissue and clean your hands right away. Avoid sharing items with other people in your home. And stay aware of how you feel. If you start to have difficulty breathing or you're worried about your health, call your doctor. For more information, visit hamiltonhealth.com or cdc.gov. Is it time for a heart-to-heart? Ask your primary care physician if you should have a heart-to-heart with one of Hamilton Physician Group's board-certified cardiologists. If you have high cholesterol, high blood pressure, or diabetes, this can be especially important. Hamilton Physician Group Cardiology, located at 1436 Broderick Drive in Dalton. Call 706-226-3434 or visit hamiltonhealth.com/cardiology. That's 706-226-3434. If you're in need of medical care, don't delay. Your health won't wait. Hamilton Medical Center is ready to care for you. We are following CDC guidelines. Patients and guests are screened for COVID-19 symptoms. Those who are suspected to have the virus are treated in a separate area. Plus, Hamilton's high-powered UV light robots eliminate 99.9% of bacteria and viruses on surfaces. Please do not delay medical care. Your health won't wait. As always, Hamilton is here for you.
Thank you for listening to Health for Life, a presentation of Hamilton Healthcare System.
Do you snore? Are you always tired? You could be suffering from obstructive sleep apnea. Hamilton Regional Sleep Center provides real solutions for sleep apnea, insomnia, narcolepsy, and restless leg syndrome. Overnight sleep testing is conducted by highly trained technologists in a warm and friendly environment. Call Hamilton Regional Sleep Center, 706-278-4757. That's 706-278-4757.
Be a hero. Stop a stroke. If you think someone you're with is having a stroke, ask him to smile. Does his face droop? Have him raise both arms. Does one arm drift down? Can he repeat a simple phrase without slurring? If you see even one of these symptoms, call 911 right away. Because when it's a stroke, every second counts. Hamilton Medical Center has a nationally ranked, highly trained rapid stroke team ready to care for you. Hamilton Medical Center, health for life.
If you are sick with COVID-19 or think you might have it, take steps to help protect other people from getting sick. And stay aware of how you feel. If you start to have difficulty breathing or you're worried about your health, call your doctor. For more information, visit hamiltonhealth.com or cdc.gov.